Addiction is a highly stigmatized disease, and we even find that some of the treatments that we use for addiction are also stigmatized. Some of the stigmas associated with having an addiction and a general perception in the public that addiction is the result of lack of willpower, poor choices, or just bad habits that people have. We often find, too, that there's stigma associated with the medications we use to treat an opioid use disorder. And so we hear in the community sometimes that we're just substituting one drug for another. One really easy way that we can all try to reduce the stigma associated with addiction is to change the language that we use. So for example, using person-first language, so not trying to get rid of terms like addict or alcoholic or terms like abuse, and instead say person with a substance use disorder or person with an alcohol use disorder, or someone who is misusing substances. Another way that we can reduce the stigma associated with addiction is to use medically accurate terminology. We know that addiction is a brain disease, it's a chronic illness, and so that we should use terms like we do when talking about asthma or COPD or diabetes or other chronic medical illnesses when talking about patients who have addiction. For a really long time, people who had substance use or alcohol use disorders were viewed as being weak, that they had a habit that they couldn't get rid of, and that they just needed to have the willpower in order to overcome what was going on and change their lives. Over the last couple of decades, we have had definitive research showing that, in fact, addiction is a brain disease. It's a chronic relapsing disease, and that people need more than just willpower in order to recover from their alcohol or substance use disorder. In our program, we handle this a couple of ways. One is just being really upfront with our patients and telling them that we recognize that this is a stigmatizing disease, and we recognize that there might have been a lot of places in their life that they've been where they've felt judged. And just by showing them that we understand that, patients often will literally just relax in our offices, and we can see that they feel like they're in a safe place. We know both through research and from talking to patients that because of the stigma associated with addiction, people are less likely to seek treatment or ask for help. That's because they are worried about being judged, or they maybe have family members who are concerned about what it's going to mean if they find themselves in treatment for an alcohol or substance use disorder. If you have any questions about what the right terms are to use or what stigma might mean when we're talking about stigma associated with addiction, feel free to ask. People who are experts or people who maybe have a substance use disorder would be happy to talk to you about that. And the humility you show by asking expresses the empathy that you have for patients who have substance use disorder.